Good morning everyone. Today's topic is ophthalmoscopy. Ophthalmoscopy is a clinical examination of interior of the eye by means of an ophthalmoscope. It is one of the techniques of fundus examination, and this is primarily done to assess the status of the fundus and to detect any opacity of the ocular media. Three methods of examination are used. One is distant direct ophthalmoscopy and indirect ophthalmoscopy. First one is the direct ophthalmoscopy. It is usually performed routinely before the direct ophthalmoscopy as it gives a lot of useful information, and it can be performed with the help of a self-illuminated ophthalmoscope, which can be seen here, or it can be also be done with the help of a simple plain mirror with a hole at the center. For this, the light is thrown into the patient's eye, sitting in a semi-dark room from a distance of about 20 to 25 centimeters, and the features of red glow are in the pupillary area are to be noted. Coming to the applications of distant direct ophthalmoscopy, it is used to diagnose the opacities in the refractive medium, if any, to recognize detached retina or any tumor arising from the fundus. A grayish reflex seen on the distant direct ophthalmoscopy indicates either a detached retina or a tumor arising from the fundus, because the normal glow of the fundus is red. Second is the direct ophthalmoscopy. In this, it is the most commonly used method of fundus evaluation. The modern direct ophthalmoscope works on the basic optical principle of glass plate ophthalmoscope, which was introduced by von Helmholtz. Here in this, the direct ophthalmoscopy should be performed in a semi-dark room with the patient seated and looking straight ahead, while the observer is standing or seated slightly over the side of the eye to be examined. Patient's right eye should be examined by observer with his or her right eye, and left with the left eye. The observer should reflect beam of light from the ophthalmoscope into the patient's pupil. Once the red reflex is seen, the observer should move as close to the patient as possible. Once the retina is focused, the details should be examined systematically, starting from this blood vessels, the four quadrants of genital background, and the maxilla. In this is the direct ophthalmoscope. In this, on the front surface, you have front surface mirror. You have a crossed linear polarizing filter or lead-free filter switch, and there is an aperture for selection of the dial. And on the other side of this, you have a brow rest, you have a lens selection disc, and you have a illuminated lens indicator. And then there is an on or off switch and the rheostat control. Through the lens indicator, you get to know if you are viewing through the convex or the concave lenses. So this is how we do the distant direct ophthalmoscopy from a distance of 20 to 25 centimeters. And through this, we can see for media opacities also, like cataracts, corneal flash, and large fluorescence, if any. So this is the positioning. The right eye of the observer for the right eye of the patient, and left eye of the observer for left eye of the patient. So coming to the characteristics. In this, an erect upright virtual image is formed, and the magnification is about 15 times. Field of view is 5 degrees. There is no depth perception to this. Several plus and minus diode lenses are there, as I told, which can be changed depending upon your refractive error or the refractive error of the patient. And we can see the optic nerve, blood vessels of posterior pole, fovea, and this can be used even in an undilated pupil as well. So coming to the advantages and disadvantages. Advantages is it is portable, easy to use. You get an upright image as the fundus is, as you can see. Magnification is up to 15 times, and it can be used without any dilatation of the pupil as well. Disadvantages is a smaller field of view, lack of stereopsis or depth perception, and sometimes if there are any media opacities, the image can be degraded. So coming to indirect ophthalmoscopy. In this, the principle of indirect ophthalmoscopy is to make the eye highly myopic by placing a very strong convex lens in front of patient's eye, so that the emergent rays from an area of fundus are brought to focus as a real inverted image between the lens and the observer's eye. So, in this, about 2.5 times magnification in 35 degrees and 8 disc diameter field of view is obtained with a plus 20 diopter lens. With a stronger lens, the image will be smaller but brighter and the field of vision will be more. For this examination, the prerequisites required will be a dark room, a single source of light, a concave mirror or self-illuminated IDO or the indirect ophthalmoscope, and a convex lens. Mostly we use the plus 20D, and pupils of the patient should be dilated for this procedure. So, for the technique of this is, the patient is made to lie in supine position. The examiner throws the light in the patient's eye from a self-illuminated ophthalmoscope. In practice, there are actually binocular and binocular indirect ophthalmoscopes, but now we are using the binocular ophthalmoscope with a headband or most frequently. Keeping his or her on the reflex, the examiner interposes the condensing lens plus 20D routinely used in path of beam of the light close to the patient's eye, and then slowly moves the lens away from the eye towards himself until you get a clear image of the retina. The examiner moves around the head of the patient to examine all the different quadrants of the fundus. He or she will stand opposite the clockwise position to be examined. That is, to examine the inferior quadrant, the examiner has to stand towards the patient's head end, that is the polyclock meridian. And also, the patient can be asked to look at extreme gazes, and by using a scleral indenter, even the whole peripheral retina up to ora serrata can also be examined. The application is, it is used for assessment and management of retinal detachment and other more peripheral retinal lesions. So this is an indirect ophthalmoscope, a binocular one, in which there is an illumination window, there is an optical unit, there is a lock knob, there is diaphragm. In this also you have the red-free filter. Then you have a headband, and also you have a diaphragm for this. So this is the condensing lens, mostly used with a plus 20 diopter lens, and this is a self-illuminated ophthalmoscope. This is the image of the fundus seen through the plus 20D lens. Here it is an inverted real image of the fundus. So the characteristics once again: inverted reverse real image, magnification of 2 to 4 times, field of view is better than the direct ophthalmoscope, 40 to 50 degrees, optimal working distance 40 to 50 centimeters, good illumination, and the depth perception is good, and it ease of use with a scleral indenter to view the periphery of the retina as periphery as the ora serrata, and the lenses may range from 14 to 30D range. Advantages: wide field of view, binocular instruments provide stereopsis. Disadvantages: it requires more skill and magnification is decreased. It requires compulsory dilatation of the pupil, and this is an inverted image.